One of the most complex but important topics in psychopharmacology is sequential binding. As a psychiatrist, this topic is a big part of how we pick medications. Let's talk about quetiapine as an example. And let's just do a little experiment in the comments. If you've ever been prescribed quetiapine, can you just drop the dose in the comments and what it was for, if you're willing to talk about it? Because I think what people will realize is that the dose range of quetiapine is very, very different for different people and different indications. Some of you will probably comment 12.5, 25, 50 milligrams. Others will probably comment something in around 200. Others will comment between 300 and 400, and then there might be one or two people who've been given quetiapine above 600 milligrams, the highest I've seen being about 1.2 grams a day. What's going on? Sequential binding is the answer to that question. Like many other medications, quetiapine is a molecule that is non-selective, which means it binds to a lot of different receptors in the brain and body. Receptors being little buttons on the cell that tell the cell to do something. Now, if I dropped some liquid quetiapine into a big bowl of receptors, it'll act as an antagonist, meaning a blocker to most of them, but it'll do so with different preference. The first thing it'll do is roll towards those histamine receptors, and it'll bind to those as if the histamine receptors were really strong magnets for the quetiapine. Once all of the histamine receptors were blocked up, it would then roll onto alpha receptors, which generally respond to norepinephrine, and it would block those. It would continue in this manner until it binds in an antagonistic fashion to acetylcholine receptors, a bunch of different serotonin receptors, and then eventually it'll block dopamine, which is what most people think of antipsychotics as doing. And that's why at lower doses, 25, 50 milligrams, antihistamine is used as a mild anti-anxiety medication for acute anxiety or for sleep. Makes you a bit less anxious, makes you a bit less drowsy. In those intermediate dose ranges, it's used as augmentation for treatment refractory depression. Only in those highest dose ranges, where it's blocking 5-HT2A and other serotonin receptors as well as dopamine receptors, is it acting in its antipsychotic function, which is how it's marketed as an antipsychotic. That also explains the side effect profile of quetiapine, which include constipation, dizziness, fatigue, sedation, and tremendous weight gain via myriad receptor mechanisms within that sequential binding profile. And now you know why you might be prescribed the same medication at different doses for different indications. If this was helpful, or if you have any thoughts, please share them in the comments. As always, I look forward to learning from you. I'll see you there.